Today's Pet Advice is sponsored by University Veterinary Care Center. Dr. Travis Gratton with University Veterinary Care Center is joining us now, and this morning we are talking about a virus that could affect the rabbit population and recent authorization of vaccines here in the U.S. That's some good news, obviously, but there's a lot to this, so let's jump in. Good morning, Dr. Gratton.
We'll see what we can cover this morning.
Absolutely. So the virus, it causes the rabbit hemorrhagic disease. What is that?
Basically, there are these big group that just get thrown into hemorrhagic diseases, which basically means you start bleeding, or it's one of the main clinical signs. Now this one, it is a calicivirus, unlike Ebola, which is a different family of viruses, and in livestock there's a whole group of hemorrhagic diseases, various viruses, but once it gets into this the bloodstream becomes systemic. It attacks the liver and the spleen predominantly in rabbits. And the liver is the organ that makes most of your clotting factors for the bloodstream. And so when those start fading out and with all the inflammation get used up very rapidly, then you get this sudden death, but there's often some bleeding so it's kind of an ugly disease. They always bring a lot of angst and anxiety when you talk about hemorrhagic diseases and that, but not a fun virus. So
what are some of the symptoms if a rabbit may have it?
Well, unfortunately, the most common symptom is just sudden death. I mean, this thing, when they get in contact with it, within hours or a day or two, can go from I'm perfectly happy to I'm deceased.
Oh my goodness. And we're talking wild and domestic. It could affect any rabbit?
Yeah, the original calicivirus, rabbit hemorrhagic disease 1, was been in Europe for 20-some years. It was mostly the European cottontail, so just wild rabbits, a few little closely related things, and then about 10 years ago rabbit hemorrhagic disease virus 2 came up, and it basically doesn't really care so much. So it's the wild rabbits, the cottontails, the hares, the jackrabbits in this country, as well as most of the domestic species. And it came in on the northwest coast up British Columbia and Canada and spread down, and then, as we'll see in a little bit on the map, it just blew up in the southwest, and most of that has been actually in domestic rabbits.
Yeah, we do have an image to show you of that from a website from the USDA, and it hasn't yet been reported in Kansas, which is my understanding, but it's getting pretty close.
Yeah, exactly. It is in, Colorado has become one of what the USDA considers endemic states, as well as most of the Southwest, and if you see, it's really kind of coming across the southern tier of states. There's also cases coming across the northern tier of states, so it really is kind of wrapping around us. One of the outbreaks was in a Colorado county that is a border county, so if it's in wild rabbits in eastern Colorado, rabbits don't care where that state line is drawn.
Just a matter of time.
It's a matter of time.
Well, we are almost out of time, but there is some hope with a vaccine.
Yeah, USDA, or FDA, sorry, approved under emergency use a vaccine for the disease. It is in distribution now. Seems to be very effective as one of the older style viral subunit vaccines, so we don't have to worry about all the controversy, hopefully. But as contagious as this is and as stable as the virus is in the environment, it's going to be nice to have something to offer if and when it gets here. And having talked to Animal Health Department last week, they're on the lookout, as is Wildlife and Parks, and they expect it to be reported before long. The trend has been, the spread is moving fast. So.
Oh, some scary news this morning, Dr. Gratton, but as always, we appreciate your insight. Thank you for being with us. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.